Trupti ma'am, please start.
Good morning, everyone. I'm glad to welcome you all on behalf of Team Maha IIP 2023 and Nasik Airtray 2023. This is the third session of the PATH program, that is Pediatricians Action for Teenagers' Health. And as all of us know, that the vision of this program is to train the pediatricians for adolescent health and arm them with the knowledge and skills required to deal with the basic adolescent problems in day-to-day life. The program has been aptly designed for the same, with introduction of important topics in the program. So the academic feast will be served on first Sunday of each month for the whole year in 2023 by great stalwarts in adolescent health. Today we have with us Dr. Preeti Galgali Madam, Dr. Suchit Tambori Sir, and Dr. Sulbha Pawar Madam. So before we begin with the session, I would like to invite Dr. Atul Kanikar Sir, who is a senior pediatrician and senior adolescent health specialist and also chief coordinator of the PATH program, to say some few words and also give introduction of the speakers. Dr. Atul Kanikar Sir.
Sir, kindly unmute.
Am I audible now?
Yeah.
Am I just looking in a window or full screen?
Yes, sir, you are looking in full screen. Thank you.
Okay. Thank you, Trupti madam. I was just thinking whether there is some line on my screen, but then I thought that let me check, and then you just cleared it this way. So thank you for that. Basically, some few minutes ago, I told that it's a very informal type of, but very, very educative type of meeting, monthly meeting that we have all across India and maybe Maharashtra especially. And each month we are, now this has been started since February this year. And the first meeting was by our teacher of all, Dr. M.K. Nair sir, and the senior most adolescent care expert, Dr. Tuteja sir. The second was by C.P. Bansal sir, and then myself as a very junior person, and Geeta Patil madam from Bangalore. So I thought Bangalore is a very beautiful city. I was there on 2-3 occasions, and on all occasions I was at Preeti's residence. Whenever I go to Bangalore, I stay with her. When she comes to Nasik, she comes and visits our home. That's our usual story. So I said the April speaker also should be from Bangalore. No, Bangalore, to be honest, to be sorry. And Preeti was quite busy last month. But as we all know that she started from Bangalore, then she, sort of conquered Karnataka, then southern India, then IIP, and now she is on such a global platform that Preeti, there is hardly any pediatrician or adolescent health expert in all over the country, and now maybe I don't know about abroad. I had never been out of India. I had been only once, but Preeti is now going globally. And the other day I called her, are you staying on Mars or Jupiter? Tell me. So, she is a very busy academician, a gold medalist from BJ Medical College, Pune. Suchit, it's our college.
Yes.
And she was a visitor, and she conquered all the medals and honors and all that. After that, she never stopped. But equally good is her being a homemaker. Her children, I know them personally. Her parents, her in-laws, they are just super, very warm people. I would say better than Preeti herself. And husband is very, very lovable, Anand Galgali. So I may not tell formally anything about Preeti Galgali as such, but she is really a very good academician, and now she is moving up the ladder from Bangalore to maybe international levels. That is what I know about Preeti Galgali. And the second speaker is my classmate. Survasi sir, you are looking full screen, you are looking beautiful, but can somebody change the mode?
लाईट गेलेले आहेत.
That is what happens when Nasik people come. No, माझं डोकं फिरून जातं. My beja goes out. Second speaker is our Suchit Tamboli sir, my classmate from BJ Medical College, very good friend of mine. He's basically a true disciple of Dr. M.K. Nair sir in developmental pediatrics. That is where he started into his real out of pediatrics academics as a super specialization. He has so many achievements as chairperson, as secretary, as whatever EB member, and God knows how many. But I'm sure he is the person who uses social media to the maximum. There is hardly a week that you don't get a WhatsApp message or email from Dr. Suchit Tamboli from Ahmednagar that he has been doing this, he has been doing this, he has been given so much of praise and awards and all that. But really now I was very glad when a few years ago he said, I want to enter adolescent medicine. And adolescence is a period where the real psychosocial development, the core personality, the basic belief system that takes shape. So Suchit was the right person, and that's why I and we all together, Trupti Mahatme, Sulba Pawar madam, Dina Rathi madam, our core team, Sangeeta Bafna madam, Suchita Malvatkar madam, who is the chairperson of our Nasik page. All these people, we sat together and we said Suchit is the right person because he knows the development of a human being right since birth up to maybe I don't know how many years. But as long as me and Suchit are of the age, whatever we are, I don't want to say, but Suchit must be 57. Suchit?
Same age.
Same age. So as long as we know our age, I think he knows the developmental stages of life. And I thought that this being the most crucial phase of life, 10 to 25. So let Suchit talk about all this. Now the third speaker is our own Nasikite, a very dynamic lady. Dynamism seems to be a family problem in infectious disorder because her husband, I would say I don't know better half or worse half, but Dr. Amol Pawar is our Maha-IIT secretary. Unfortunately, he couldn't join today. But she is a PGDAP from CDC Trivandrum, another disciple of M.K. Nair sir. And Preeti is, I think, from the first batch of PGDAP. Yeah. So now Sulba Pawar madam has done PGDAP and she is into adolescent practice. And a very sincere, hard working lady, I would say, and very polite lady. So these are our three speakers for the day. So I think now we can start with the first session by none other than Dr. Preeti Galgali madam from Bangalore about the basic core thing that we all should know when a teenager walks into our clinic. So over to Preeti madam.
Thank you very much, Dr. Atul. A very warm good morning to all of you from Bangalore. It is indeed a pleasure to be invited to speak on this platform, the Maha-IAP platform. Again, many congratulations to my senior in college, Dr. Ramakant, Amol, Atul, for taking us onto the path, I would say the golden path of adolescent medicine. You have already been led forward, and my task, at least I think, becomes all the more simple because many of the basics, and I was seeing the previous recordings, have already been discussed. And so let's get going. Can you all see my screen? Is it visible?
Yes.
Okay. So it is said, a journey of 1,000 miles is made with the first step. And in fact, interviewing adolescents is indeed the first step. It actually tells you and it makes you understand the adolescent, and it allows the adolescent to choose you as their guiding light in this golden and fascinating period of life. Am I audible and visible?
Yes,
Okay,
both.
okay, thank you. In between, I thought I had a network issue. Now, most of what I would be saying in the next few minutes is taken from the IAP guidelines on adolescent health published in June and July 2022. And I would urge all the participants today to really go through these guidelines. In the next few minutes, we would discuss what is the theoretical basis of interviewing adolescents. Why do we, after all, need to interview them? A few practice pearls, and I will finally, end with a few case discussions. Now, coming to the theoretical basis, we all know adolescence is a transitional period of life. It is, in fact, a bridge between childhood and adulthood, and health in adolescence actually determines health over the entire lifespan, and hence the importance of adolescent medicine and of interviewing and knowing adolescents. We all know adolescents form 18% of our population and 16% of the global population. In fact, we have 1.8 billion adolescents and young adults on the earth now, the largest ever population in the whole of universe. So it's a good thing to know before we start interviewing adolescents, what are the common problems that we see in India? And this is what the WHO says. According to the age, you can see infections, diarrhea, tuberculosis, pneumonia still remain a problem. And apart from that, what I have highlighted in bold are very adolescent specific issues, which we probably may not pay much attention during routine pediatric care. And this includes road injury, drowning, self-harm, interpersonal violence, maternal conditions, iron deficiency, anemia, childhood behavioral disorders, intellectual disability, migraine, skin diseases. Another point to remember is 28% of the young people aged 15 to 24 years are not in education, employment, or training. And we often know that empty mind is a devil's workshop, and these are actually vulnerable to various physical and mental health problems, and we need to take special care. And we all know in recent times there has been increase in sexual behavior, and 1/4 of our adolescents are married. And there has been a rise in non-communicable diseases in the form of mental disorders, obesity, hypertension, diabetes, smartphone addiction. So these are important clinical points to remember when we think about interviewing adolescents. Now, coming to what are the determinants of adolescent health? This is extremely important slide because this tells you the pace of your psychosocial interviewing. Why should we talk to the adolescent about family, school, peers, community, the media? Because all these have an impact on the adolescent health. So let's take the example of a child who has ADHD, attention deficit hyperactivity disorder. He is 12 years old. He lives in a family where alcohol is easily available. The father has an alcohol use disorder. He goes to a school where there is no remedial education facilities available because this child with ADHD also has a learning disability. He has peers who consume alcohol. Alcohol is easily available in the community. There are no adolescent-friendly health services available, and the media glamorizes alcohol use. So what do you think is going to happen here to this adolescent? This adolescent, there's a high chance would develop an alcohol use disorder and may even go into crime. Let's see the other factor. If there are protective factors, so he has ADHD, the family is supportive, so is the school, the peers are very encouraging, the community has strict laws, there are adolescent-friendly health services available, and also the adolescent physician tells him about healthy media use, and he's connected to his parents, he's connected to his school, he's spiritually alive. and hence he develops into probably the next doctor down the lane. So how is that? So we must remember that the determinants of adolescent health is all a balance between risk and protective factors, and we as adolescent health specialists need to enhance the protective factors and actually tell the adolescent, or rather teach the adolescent, how to manage the risk factors. Again, the focus on adolescent interview, taking a history in all the domains. We also know that adolescent is a second window of opportunity. We all talk about the first 1,000 days of life. In fact, now the focus is on the first 8,000 days of life, and that includes 0 to 24 years, because the brain is highly plastic. So whatever we talk to the adolescent, the way we guide the adolescent, not only us, but the other non-judgmental, trustworthy adults in their lives, can actually mold the brain for the better. And you know, as we are so familiar with growth and development as pediatricians, we are indeed the best professionals to provide adolescent care, to tap into this window of opportunity. Hence, we all really need to reach out to adolescents. We also know about the phenomena of tracking. We also know that risk factors like physical inactivity, poor stress management, alcohol abuse, unhealthy diet, tobacco can track into the adulthood, leading to all non-communicable diseases. So much so that the WHO says that the 70% premature adult mortality and morbidity are due to behavior and conditions that begin in adolescence. Hence, our antenna should be up to pick up this, and hence this should form a part of your adolescent interview. Not only that, 50% of the mental disorders present before 14 years of age, and this also we need to pick up. So in very, very brief, there are 3 windows of opportunity. Why? Because the changing body and mind, there's an opportunity for catching up. So you see an adolescent who has faced adverse childhood experiences. The way you manage this adolescent in this particular phase of life may make a difference for the adulthood. And of course, we know about the intragenerational transmission. Adolescents today will, if they're healthy, will make healthy parents of tomorrow and will give rise to a very healthy progeny. We all know about the Rashtriya Kishore Swasthya Karyakram, which focuses on all high-risk behavior. I would urge all adolescent health specialists and pediatricians to join hands with the government and participate in this. And as you can see, reproductive and sexual health, nutritional well-being, healthy lifestyle, violence-free living, substance use, mental health, all are a part of this, and all will be a part of our adolescent interviewing. Just to share a little bit of work which we are doing, we have been having this Bangalore Adolescent Care and Counseling Center since 2004, and Dr. Nalini is our clinical psychologist. Ms. Sharda is a special educator. We have done around 310 teleconsultations during the pandemic, and we have reached out to around 1,900 adolescents. And what I'm speaking to you today may not be from the textbook exactly, but this is what is the experience that I have gained over the last couple of years and the way I use this to interview adolescents. So again, it's a good idea in your local area to find out what are the key adolescent problems. And in this way, you could tune your interviewing to make sure that you do not miss on asking the adolescent on these various issues. And this is what I see in my own adolescent clinic, the top 8 problems. Now, we all are familiar with adolescent development. So what do the adolescents say? They say, respect my privacy. Don't treat me like a child. I don't want my parents to know. I want to have a say in decisions about my health. So as a pediatrician, as a health professional, when we are interviewing adolescents, what are the key areas? You'll all agree with me: privacy, confidentiality, and respect. This is what the adolescent is looking for. But the research from India shows that adolescents do not get this confidentiality. And so not only the adolescents, but also the family complains about the same. There is lack of time on the part of the health professional. There is no privacy. The health professional is not very eager to discuss sensitive issue. The adolescent fears reprimand and embarrassment, shame, guilt, and fear of disclosure. So when we talk about interviewing adolescents, we should know about this background research, and we should know what to avoid and what to stay away from and what to include. There is a lot of interest in adolescent medicine in recent times. And just like the nurturing care framework, globally, people have adopted the nurturing care framework for adolescent well-being. I would urge all of you to read this article in the Journal of Adolescent Health, which gives you a lot about how to define adolescent well-being, what are the components: good health, optimum nutrition, connectedness, safety, learning, agency, and resilience. And this is what we need to focus on, both are interviewing as well as counseling, because interviewing and counseling are very, very closely related. So again, on the international front, there's the Global Forum for Adolescents, which is going to be conducted on 11th and 12th October. I urge all of you to go to the website and be a part of this. This talks about youth engagement for adolescent well-being, and this fantastic collection in British Medical Journal, the Adolescent Wellbeing Collection, was just released a couple of weeks ago. An excellent collection of articles which talks about all the latest in adolescent health. Is it just the old wine in a new bottle? Yes, it is, maybe, but it's worth a look once again, and hence the importance of this session today. So now that we know, it's not because the whole world is talking about adolescents, we know as a health professional the importance of reaching out to adolescents at the right time to ensure life over the entire lifespan. Now, a few practice pearls. How do we really, I'm sure you all agree with me that we need to interview. Where do we interview the adolescents? Do we interview them in our pediatric clinic, or do we have a special adolescent clinic? So this is my own adolescent clinic, and I have put pediatric/adolescent clinic because I do have a separate time to see adolescents. But let me tell you, any child above the age of 10 years, the principles that I am telling you today about your approach to the adolescent, time does not matter. Whether it is 5 minutes, 10 minutes, or half an hour, you should have the very same approach when you talk to an adolescent. So it is your choice. If you have the time, you could have a special time for the adolescents, because sometimes adolescents don't want to be seen with their pediatric patients. They want to have a reception area which has more material which is relevant to them, telling them that it's okay to talk about HIV, it's okay to talk about sex, about your career. That may make them feel more comfortable. You could have a display board which tells about the importance of adolescent care and the timings. So this would be an excellent entry point for the adolescent. But nevertheless, make sure that your consultation chamber has a door. Because remember what we said, privacy is extremely important for the adolescent. So make sure it has a door. If possible, you can have a separate area to examine. You may even have a screen to condone the area. That's absolutely fine. Before you start off with your interview, make sure you have an adult stethoscope, adult BP cuff, orchidometer or audiometer. Make sure you have your Tanner's chart, immunization chart, growth charts right there, because after the interview, you don't want to be hurrying here and there and for looking for these charts. It's also nice that if your adolescent clinic could have a seminar room for parenting sessions, life skill sessions, and a lab. So this is the setting. This is the setting for the adolescent interview. But what should be our professional attributes and skills. It's a good idea to be trained a little bit in adolescent growth and development. We ourselves should be well adjusted with good emotional control. You all know that sometimes adolescent can be a roller coaster ride, and if we are on our own roller coaster, I don't think we would be able to really do justice to the adolescent issues. Important for us to also practice self-care. We should have a genuine interest. We should be open-minded and flexible in our approach. Now, if here's an adolescent who comes in and you come to know that he goes to a red light area and he also smokes. And if you roll up your eyes and you start frowning, this is not at all good for adolescent well-being and for your adolescent interview. It is best that you refer this adolescent to another adolescent-friendly specialist. You must also be familiar with the laws of the land. An adolescent above the age of 12 years can give consent for history taking and examination. Below the age of 12 years, you must have the parents in the picture. The parents should know about it. Only an adolescent above the age of 18 years can give consent for investigations and drug therapy. These are useful laws to know because we have to think about our safety first. Of course, you're going to ensure privacy and confidentiality, and they are going to be laws of confidentiality, which we should be familiar about. I'll tell you in a minute. And also, we should know and practice effective communication skills. Communication skills is the key for adolescent interviewing. So the Indian law says the personal health information should be kept confidential except in sexual abuse, suicidal behavior, self-harm, crime, a medical legal case, or hospitalization. So when you start your interview, you can tell the adolescent, whatever you share with me, I shall not share with anybody else unless I feel that the information that you have revealed to me is harmful to you or to others, and I shall inform you. And the person whom we choose to share this information with, I shall discuss with you. Only a trustworthy person chosen by you would have access to this information. Have you understood? Is it okay with you? So these are very, very important statements to start with when you interview the adolescent in private. And how do we really go about interviewing? So, it's a very flexi kind of thing that you could follow. If you are very comfortable, you could have the parents and the adolescents together for the first few minutes. Then you could ask the parents if you could talk to the adolescent alone, and then get the adolescent and parents together in the end. But what happens usually is, if there are a lot of issues because of the conflict between parents and adolescents, the parents tend to take away all the time. In such a case, sometimes I see the parent first and then the adolescent. Or if the adolescent says, no, my parents are really going to, tell you a lot of bad things about me, I want to see you first, then that's absolutely fine. So again, be flexible in your approach. Now, this is the most important slide of the whole presentation, and I must thank Atul for this wonderful slide. Extremely important. As I said before, take consent. Sometimes the adolescent may say, no, I don't want my parents to be out. I want him to be here, especially the early adolescent. That is absolutely fine. You can have the parent right there for the first session. And after some time, you will know when you have developed that rapport with the adolescent, he will say, I want to see you alone. So don't get, very hurtful that, oh, he doesn't want to see me alone, or she doesn't want to see me alone. Again, ensure privacy, express confidentiality limits, be respectful. As the adolescent enters your room, please make eye contact with the adolescent first. Say good morning, welcome. I want you to introduce the people who are accompanying you. That really puts the adolescent on a high, gives him that much needed respect. Otherwise, at home, the parents would be saying, you don't do this right. I saw you smoking. I saw you with a girlfriend. Nothing is good about you. And here you address him first and say, please introduce me to the people who are come with you. It really sets the pace for your therapeutic alliance. Again, when you're talking to the adolescent, keep it short and simple without scientific jargon. We often say the KISS principle. Don't kiss the adolescent right away, at least. But yes, keep your communication short and simple. And refrain from using you statements. You are in this problem because you don't study regularly. Okay, so the moment you say you statements, you're accusing the adolescent. Use apt words, tone, and pitch, and let it be just right, fitting into the mood of the interview. Ask open-ended questions. Is your relationship with your father good? Turn it around. How is your relationship with your father? Okay, and this will give you a peep into the window of the relationship, and you can even go into the whole house of the relationship by asking an open-ended question. What is active listening? There are 4 components of active listening. One is paying attention. Second is minimal responses. Oh, really? Howda? Amile, what next? Okay, and the third is reflecting emotions and reflecting words, and the fourth is summarizing. So you have this adolescent coming to you who has joined a new school, and the parents say he's very, very unhappy in the school. So you start talking to him and he says, oh, doctor, I'm really very uncomfortable with my new friends and the teacher. So then you said, what makes you uncomfortable? It's because you want to hear more from him. So you're asking an open-ended question. So he says, oh, I'm very hesitant to make new friends, and my teachers, I feel I'm not making a good impression. So then you reflect, you say, I can see that you are a little uncomfortable because you have not been able to make a good impression and you've yet to make new friends. And then he corrects you and he says, no, I'm not worried about the friends. The only thing which bothers me is about teachers. So you know where you need to focus on. And that is the power of active listening. Remember always to praise the adolescent. That was very brave of you to share this with me. Validate emotions. Yes, it's often when you go to new places, you kind of reach a certain level of comfort only after a few days. Empathize. I know to make an impression on new people is difficult. Address concerns. How do you want to make an impression? What do you think will make an impression? Reassure, build up hope. I'm sure let the adolescent look for his own solutions. You don't rush to give solutions. Answer in the class, do your work properly. Let the adolescent say this. These are all very simple things you may say, but remember, as you're interviewing, as you're talking to the adolescent, you are rapport building also. You are building a therapeutic alliance also. And as I said before, be non-judgmental. Avoid moralizing, preaching. Things will be soon better. No need. Usually it happens with me also. You need not share all your stories. You can just reinforce and praise and appreciate what the adolescent is doing. And non-verbal communication, in fact, we say around 93% of our communication is non-verbal. And what does it consist of? Eye contact, proximity, same level, our facial expressions, nodding, position of hands and leg, an open position rather than a very authoritarian position. Silence, extremely important, very powerful way of communication. The adolescent has a meltdown. You need not rush to say, don't cry, you should never cry. All you need to do is to give a tissue, a glass of water to the adolescent. Do you want to have this? Allow the adolescent to regain back his composure and then go about speaking to him. Holding hands, patting, very good, but be careful about not really crossing the boundaries of the adolescent. So you have to be careful about that. And another thing is, it's a good idea to have visual and auditory privacy. But what I do in my own clinic is I have these see-through glasses. When I'm talking to adolescents, the parents can see me talking, but they cannot hear me. So this is while I'm doing an interview. Of course, for a physical examination, we need to have another chaperone of the same sex. And of course, those windows are then covered by the curtains. Now, I would always say this, listen more, talk less. God has given us 2 ears and 1 mouth. There is some logic to it, of course. Now I want you to see these 2 pictures. Okay, let me see if I can get them. Okay, doesn't matter, it's not coming, no problem. Now, adolescent interview. So what is the function of an adolescent interview? I would say again and again, to build a therapeutic alliance. It is not just knowing what the adolescent's problems are, it is the building of a therapeutic alliance, not only with the adolescent, but also with the parents and the caretakers, which is very, very important. So what does an adolescent interview do? And there are different ways of doing it. Head screening, which we'll be talking about in just a minute, is one of the ways. But remember those circles which I showed to you. We have to analyze the multiple biopsychosocial domains. We can go from less sensitive topics to more sensitive topics. Like we could talk about home and school first before going to sexuality and drugs, and that can be tackled later. We have to know about the strengths, for example, the social support, connectedness, religiosity, and spirituality of the adolescent. Also know about weaknesses. We need to know about protective and risk factors. We need to know about aspirations and goals. Identify areas of intervention. A child comes here with a white discharge and you feel she has a sexually transmitted infection. You also know that she is being abused by her uncle at home. So the priority here is safety of the child. That is most important. And yes, of course, you would treat for sexually transmitted infection and also do mandatory reporting. But first, ensure safety. Now, your adolescent interview aids in strength-based and motivational counseling, also helps you in imparting anticipatory guidance. You talk about drugs and the adolescent says, no, I don't believe in taking drugs. This gives you an opportunity to praise the adolescent and say, if somebody was to offer drugs, what would you do? And what is the reason why you don't want to go in for drugs? So these are important points for giving health education. Of course, there will be variations in this adolescent interview according to the time available, the age of the adolescent. For example, an adolescent in early adolescent phase would be more focused on concrete thinking, while that in the late adolescent phase can go into formal logical operation. What does that mean? I had this adolescent coming to me and I was talking to this adolescent on why he should not drive. He was just 11 years old. And I told him, you should not be even dream of driving. So I said it in a more abstract form. And what did he say to me? He looked out at me and he said, Doctor, I know I will not drive, but what is the harm in dreaming? Why can't I dream? So you understand what I did was a mistake. I should have stuck to concrete thinking and not gone into the abstract form. Also, it will depend on the culture. Somebody comes wearing a hijab. No problem. You don't need to roll your eyes on that. Please respect the culture of the adolescent. For vulnerable adolescents, suppose some child has experienced sexual abuse, you need not rush to take a history. You can just allow the adolescent to get over the anxiety and then take a history. Your history taking would differ for chronic medical disorders, for transition to adult care, and in these conditions would focus more on adherence to medication. Of course, the way you interview parents, caretakers, teachers would also be different. Now coming to head screening. Now head screening is one of the ways of interviewing an adolescent. It is an acronym which stands for history taking in home and environment, eating, body image, education, employment, activities, drugs, suicide, depression, sexuality, safety. So this was the classic head. And now you know it's become heads. More and more of S's are being added to it. And the various S's which have been added to heads in recent times are spirituality, social media, and also a lot of emphasis on sleep. So again, be open and flexible. I would request all of you to go through this fantastic article, which is available free online, which would give you all the questions that need to be asked in a heads interview. But just to give you a just a whiff of what it is. Now, listen to me carefully, and I will give you an example of some of the questions. Who all are there at home? How many family members are there? On a scale of 0 to 10, rate your relationship with your father. If I was invisible and I was to see your parents disciplining you, what would I see? What are the ways in which you help in your household? What do you feel about your academic performance? Do you participate in any other school activities? How is your relationship with your peers? How is your relationship with your teachers? And if the adolescent is employed, how are the conditions at the place where you're employed? What are the things that you eat in a day? How do you feel when you look at yourself in the mirror? How do you spend your time after school? Do you have any hobbies coming to media use? How much time do you spend on the media? What all websites do you go to? How do you feel after using the media? Have you ever tried to reduce the media use? Has it really worked? Do you feel you are for a long time on the media? Sleep. Is it easy for you to sleep? How many hours do you sleep? Are there things which disturb your sleep? Do you follow any organized religion? What are the ways that you build up your spiritual practice? Do you meditate? How do you feel after meditation? If you were in trouble, whom would you confide in? What is your purpose in life? What do you feel about drug use? Have any of your friends used drugs? Has anybody forced you to use drugs? And then we have the craft questionnaire to assess whether drug use is mild or it is severe. Also about suicidality and depression. There are times when people are facing a lot of problem, they think of ending their lives. Has this thought ever crossed in your mind? Has there been a change in mood or lots of interest in activities that you previously enjoyed for more than 2 weeks? How have you coped with stresses before? Tell me about your menstruation. When did you attain menarche? Are there any problems during menstruation? When was your last menstrual period? Whom are you attracted to? Boys, girls, or both? Do you have any intimate friend? How do you spend those intimate moments? Have you ever been pregnant? Are you sexually intimate with somebody? Do you use contraceptions? Has there been any vaginal discharge or pain abdomen? Have you ever been treated for sexually transmitted infections? Has anybody ever touched you in a way that you did not like? Have you been ever sent messages that have made you very uncomfortable? Are you happy to be a boy versus girl? How do you want to be addressed? What are the pronouns? In fact, talking about pronouns, now they say right when the adolescent comes in, when you ask, what's your name? What are the pronouns that you prefer? Could be an opening question as well, depending on how familiar you are and how comfortable are you in asking these questions. Of course, we also assess for safety about vehicle driving and whether they wear seat belts and helmets. So this is to show you just a few questions that can be asked in heads, and you will get the complete list from the article. In the last part of my presentation, coming to a few case discussions. If it was not for heads, I would have missed the diagnosis and I would not have been able to manage these cases. So this father got his son and said, then this child was 13 years old. Oh, doctor, help me. He is balding. And when we went into a detailed history, and here the focus was home. So the story was that this child had ADHD with learning disability. He loved football. The parents had stopped football and had put him for rigorous training for preparation for IIT. Right in 7th standard, this child had developed trichotillomania, and I thought this was a perfect case to be referred to a psychiatrist. And as usual, as it happens, they refused to go to a psychiatrist. So after 6 months of going back to football, parental coaching, and remedial education, you can see the beautiful hair lock was right there. Well, to tell you, this is not the picture of my patient because this patient refused to be photographed. I've picked this up from the internet. It is very close to what my patient looked like. After 6 months, it was vacation time, and we were thinking of various hairstyles. So you can see the focus here was home education, not exactly suicide and depression, but anxiety. A 14-year-old girl came with fatigue and decline in academic performance. She had a weight loss since 3 months. She had a dimorphic anemia with vitamin D, vitamin B12 deficiency, refusal to drink milk and take hematinics and vitamin D supplementation, and insisted that her diet is healthy and iron-rich as advised by peers and social influencers. So what had happened here? In fact, she was referred by another pediatrician. The problem here was she had a body image issue and she had turned vegan. So again, taking a history for eating, activities, social media helped me to tell her that she thought she was healthy, but her reports did not say so. Her BMI was much low. She aimed to become a doctor, but how could you become a doctor if you don't have enough knowledge about nutrition? So we started talking on that, and she was back to taking a healthy vegetarian diet and was eager to take her hematinics and vitamin D because she was inspired to become a doctor who is healthy. This mother came with this boy and said, "Doctor, please see, he has cut himself. He is involved in a love affair." And the son said, "My friends dared me, doctor. I did it. It was exciting." The story again was this child had a learning disability. His friends were not including him in another group. And to just fit in, he had taken in that dare. He was very good in yoga. His parents had stopped his yoga. So again, the management was going back to yoga, talking to the teachers, talking to the peers, doing life skill sessions for the peers. And after a few months, he was back with a big cup and the yoga posture, which won him the prize. So again, what was that in heads? Education, asking about suicide, self-harm, and activities. So this mother said, "Look at this, doctor. My daughter has shared these very, very revealing pictures with her boyfriend, and I want to kill her." This was a case of sexting, and here the history emphasized on taking a history about sexuality, social media, safety, activities, talking to the adolescent about the digital footprint, telling the adolescent, before you post, think, is it true? Is it hurtful? Is it illegal? Is it necessary? Is it kind? And posting images of your body parts before the age of 18 is actually child pornography, and it is a crime. And such can be reported at the Government of India website, to the child line, and to the cybercrime helpline. So these are some of the things which could be told to the adolescent while you are eliciting the history. As Atul said, my husband is an orthopedic surgeon, and this child came with pot spine. He had no response to the treatment, and in fact, his kyphoscoliosis was worsening. And my husband sent him to me and said, "Have a talk with him, have a look at him." And what do I see? I see these needle puncture marks. This was a case of TB spine with opioid addiction. And it's only after the addiction was treated that he went in for spinal surgery. He was on naloxone. Unfortunately, we lost him during the COVID. As you can see, this is a 2005 picture. We kept following him up. During COVID, we lost him because he did not have access to naloxone. So knowing about the employment, he was working as a driver, and in the COVID, all the health facilities where he was staying were closed. This child came to me, 18-year-old, with sighing. And he had already taken a lot of medications from the pulmonologist and also from the psychiatrist. And all I asked him is, "Has anything made you upset in the last few days?" And he said, "Yes, doctor, I have broken up with my girlfriend with whom I was in love since LKG. And I kept quiet, silence on my part." He went on and on to describe his relationship since LKG to 12th standard, and how this girl is now having multiple love affairs. I just allowed him to talk, and I kept quiet. And it was all about sexuality. It was all about his effect of knowing this girl, breaking up with this girl, effect on his education, having mild depression. And then we talked about safe, healthy, happy relationships. We talked about all those qualities and how this girl did not fit into it. He went on to do his PhD from US and now is in love with another girl, happily married. And a couple of months ago, he came with his baby and the circle of life was complete. He said, would you be the pediatrician for my baby when I am in India? So you can see again, talking about sexuality actually saved the day. The last case, 12-year-old girl presented with recurrent UTI, 8 episodes in 1 year, ultrasound, MCU, DAMSA, renal parameters, all normal. She was put on antibiotic prophylaxis by the pediatrician and pediatric surgeon for 6 months. The only question that I asked her is, who gives you a bath every day? And there the answer was, it was child sexual abuse by the father, because the mother thought that she was not capable, even though she was 12 years old, she was not capable of taking care of her hygiene. The father was giving her a bath, and there he was abusing her. And that was the cause of recurrent UTI. Now, this is a case which we see very, very commonly, coming with tension headache, recurrent abdominal pain, and examination investigations are all normal. How does HEADS help us? And as you can see, if you go into HEADS, you will understand high parental expectations, learning problems since several years, junk food consumption, worried about dark complexion, spending a lot of time in sports and co-curricular, feeling anxious and tense just before exams, physical and emotional abuse. Unless you take her HEADS, how would you know her strengths, that she wants to become an engineer? She's extremely popular in school. And yes, they are stressors, and stressors are by not only partnering with her, but also partnering with parents and partnering with teachers and taking care of her learning problem by partnering with psychologists. So sometimes HEADS comes to your rescue when a colleague says, hey, Preeti, you think you're too good in adolescent medicine. You referred this case with irritability and severe headache. There is nothing wrong with her. I think she has a broken love affair. And I knew this 11-year-old since she was a small baby, and I was very thorough with my HEADS. I knew there was conjunctival congestion, and I felt there was a squint. There was something going on. I went ahead and referred this girl to another ophthalmologist. We did an MRI scan, which showed medial rectus cysticercosis. So it is HEADS which comes to us rescue and says, no, there is no psychosocial problem, even though a colleague is seeing there is. So in the end, remember, adolescent interview, the practice mantras are, even if you're not able to do anything, make them feel good, because people will never forget how you made them feel. And of course, seek first to understand and then to be understood. Always understand the adolescent before trying to tell him or her what to do. Rather, refrain from them. Respect the solutions that they talk about. Of course, adolescent medicine is all about partnership. It's all about growth. Can we do a short form of HEADS? Can we do a mini HEADS? In the COVID, we started thinking about this and we published these practice guidelines. We said just 2 questions. Do you have any specific worries and anxieties? Do you have any problem in your online education, in your relationship with your parents, in your relationship with your friends, or on the media? Just 2 questions, and you have all the HEADS right there. If you can do it, it would be wonderful. So I would urge all pediatricians to include adolescent care in your clinical practice, because the rewards are immense. And you can see smiles here. And this young man, I've taken his permission before sharing this picture. I tell you, he had such a adolescence full of turmoil, lots and lots of turmoil. Just being there for him mattered. And now he's a chef in the top 5-star hotel in Bangalore. And this is a selfie taken a few months ago when he treated me to one of the best food that I have ever eaten. And this is a picture from a child whose parents said, you don't deserve to be a painter. Push all your paintings down the gutter. You only need to study. And he has gone on and done painting exhibitions. And this he presented to me a year ago, one of his best paintings. And I look at it and I smile each and every day. In the end, I would like to thank all adolescents who allowed me to interview them. I would also like to thank my gurus, Dr. M.K. Sinaya, Dr. Swati Bhave, and Dr. Atul, of course, Dr. Tuteja, Dr. Bansal, and all my colleagues who allowed me to bounce some wild ideas, some not so good ideas, and to improve my communication skills. Their feedback and their help mattered. And of course, my parents, my in-laws, my husband, and my children who gave me the time and the peace of mind to interview adolescents for as much time as I wanted. Thank you very much. It has been a pleasure talking to you.
Thank you so much, ma'am, for such a wonderful session. The session was quite elaborative and is also great importance to how to pip inside the context of adolescent life systematically. If anyone has any questions, please put them in the chat box. If time permits, we will take the questions in the end. Now, let us move on to the next session. So as we all know, adolescence is a period when people are susceptible to engage in risky behaviors. And to discuss the same, we have with us a dynamic young lady pediatrician from Nasik, Dr. Sulbha Pawar. Sulbha, the virtual dais is yours.
Yes. Am I audible?
Yes.
I'm just sharing the screen. Is it visible now?
Yes, just make it full screen.
Yes. Now?
Yeah. Yes.
Thank you so much, Maha AP, Dr. Atul Kanikar, sir, and all seniors here on the dais today. I'm very happy to talk on today's topic, adolescent risk-taking behaviors. But Dr. Preeti Galgali has made the platform so huge that I think I'll be falling much on a smaller ground. What do you mean by risk? Risk is essentially just a behavior for which outcome is uncertain. As adolescent is particularly filled with uncertainty, as young people figure out who they are in the context of shifting social landscapes, new responsibilities, and more challenging schoolwork. As we all know, mid-adolescents have the highest heightened vulnerability for risk-taking behaviors. Between the age group of 14 to 22 years, it is seen more in males and continues in adulthood than in females. Factors influencing risk-taking behaviors: sensation seeking, peers, influence of experience, and delayed executive functioning. What is sensation seeking? Changes that occur in the parts of the brain that increase teens' tendency towards risky behavior are the areas that develop early, like limbic system or reward system. When engaged in sensation seeking behavior, there is increased release of dopamine that leads to stimulation and activation of the reward system. This enhances the adolescent's desire for independence, to seek novel experiences, and engage in more adult-like activities that are associated with risk, for example, alcoholism, substance abuse, reckless driving, and early sexual activity. Peers. Peers are another most important influence on risk-taking behavior. Adolescent sensation seekers not only associate positive effect with risky behavior, but they also seek out the peers with similar interests. And the chain goes on. They start creating social groups which are involved in risk-taking activities, adventures, games, bullying, criminal activities, and gang formation. Combination of the sensation seeking and peer influence together has a greater influence on risk-taking behavior than either sensation seeking alone or only peer influence. What is the influence of experience? The impaired impulse control that occurred in the first few years of life due to exposure to chronic and severe stress or extreme life situations can have toxic effect on the range of behaviors and the health outcomes in adolescents. Adverse childhood experiences like exposure to abuse, neglect, domestic or community violence, family substance abuse or mental illness, broken families, separation from parents, homelessness, discrimination, natural disasters, and war are the serious traumas that result in toxic chronic stress. Such children are at a higher risk for adolescent pregnancy, early sexual activity, substance abuse, intimate partner violence, suicide, and poor physical health. What is really executive functioning? As we all know, that the adolescent brain start developing from back to front The most important area of the brain that is required for executive functioning is the prefrontal cortex that start developing at around late adolescence to young adulthood. And also we know that the brain development start from inside to outside. So the myelination or the neuronal developments, neuronal maturity starts from inside to outside. So the limbic system or reward system develops first and then the prefrontal cortex. The delayed developed prefrontal cortex, this prefrontal cortex which is developed allows us to access the certain situations, consider the consequences and control the impulse adequately. The gap between the increased sensation seeking of the reward system and slower developing prefrontal cortex puts adolescents at a particular jeopardy for risk-taking behaviors and potentially unhealthy outcomes. Here we can see the limbic system or the inside part of the brain which is developing early and the prefrontal cortex is developing late. We see, as Madam told earlier, the neighborhood, poverty, discrimination, inequality, family, peers, schools, all these can be supporters as well as stressors. This can lead to biological factors and temperament or cognitive factors. We can have the voluntary and involuntary responses which create our adaptive or maladaptive behavior in the coming years or in the adolescent. What are the healthy risk-taking behaviors? Like the sports competitions, art and architectural activities, volunteer activities for the social cause, making new friends, constructive contribution to family or community. All these are examples of healthy or positive risk-taking behaviors. So long-term consequences and hardwiring of the brain of such good activities leads to the positive impact on brain pruning and adolescent personality development, which leads to healthy and responsible young adult citizens helping in nation building. So what are the negative risk-taking behaviors? As mentioned earlier by ma'am also, alcoholism, tobacco and cigarette smoking, substance abuse, risky sexual behavior, eating disorder, sexting and risky use of social media, violence, truancy, stealing, gang activities, self-harm, suicide are the examples of high-risk behaviors that adolescents can adopt if left unattended. When stress, arousal, or sensation seeking becomes extreme, the adolescent brain is flooded with the impulses that overwhelm the prefrontal cortex. As a result, adolescent engages in the increased risk-taking behaviors and emotional outbursts, even if they understand that something is dangerous. Prevalence of risk-taking behavior in India particularly. See the start of mean age of alcohol drinking, or the mean age of initiation of drinking is 14.4 to 18.3 years. Percentage of adolescent tried alcohol by the age of 18 is 60 to 70%. Substance use, particularly by a single adolescent, is 14%. Adolescent involved in active road traffic accident by driving themselves is 10%. And risky sexual behavior is 64 to 70% in boys and 53% in girls. Violence real life exposure is 69% by the adolescent age, and real partaking in violence is 5 to 7%. How to decrease the risk-taking behavior in adolescents? Early intervention before the child reaches the adolescence is the best time to teach executive functioning and self-regulation skills that can reduce the impulsivity. Teens need to get life experience. When high sensation seekers engage in risk-taking in the safe environment, they develop more patience. And patience is the factor that can reduce further risk-taking behavior. Teens also need to learn from consequences of their experiences of risk-taking. What are the practical solutions for a teenager to prevent risk-taking behavior? And most important part is a good communication in family, taking family meals together, engaging in the recreational activities like the sports, arts, music, apart from music and dance, apart from the curricular activities, serving community, volunteering, set rules at the home and stick to the rules, be clear about the consequences of the risk behavior, talk about the values, ethics, social norms, religious and cultural norms of the family, get to know your kids' friends and the circle of their friends, create supportive environment at home. These are the very basic and very important practical solutions to prevent a risk-taking behavior in adolescent. What are the protective factors for adolescent well-being? Satisfaction with the parental relationship, family connectedness, presence at least of one parent at home, moderate expectations by the parents, confiding relationship with the parents. This about the family. What about the school? The school connectedness, feeling of the closeness to the teachers, impartial or compassionate teachers, respectful attitude towards the school and teachers, emotionally compatible peers with the similar interest. And what about the self is the most important is the self-confidence, well-developed coping skills, interest in the sports and cultural activities, moderate studying time 2 to 4 hours a day, and involvement in the family and religious activities. What are the protective factors and what are the harmful factors? As just we saw, protective factors is the quality time with the children, basic life skills, authoritative parenting style, family connectedness and comfort with the peers. What are the harmful factors? Media and peer influence, unrealistic parental expectations, coexisting mental health disorders or the substance abuse, and inappropriate stress management. Now, coming towards one of the last slides. So when to seek help from the experts? When the most important and the most functional judge at your home is your mother. She knows when you're disturbing, when you're getting disturbed from your child and when you're seeking help from the experts. Sudden deterioration in the school performance, drastic changes in the behavior and mood swings, isolation from the family and friends, prefer to remain alone most of the time, separation from long-time friends, or changes in the peer groups, or frequenting the strange friends. What is unusual requirement or demand for money, or they start stealing at home also, lack of interest in the hobbies, or unusual social or recreational activities. Thank you. Here I'm coming with the picture of a family. When you start taking positive reinforcement behavior, authoritative parenting, and putting limits and rules at home, you need not go beyond this. Thank you for the opportunity for me today. I made my presentation very small so that we should have some time for discussion also. Thank you so much. And I'm very much thankful to Dr. Atul Kanikal sir for sharing some slides to me. Thank you, sir.
Thank you so much, Dr. Sulbha, for such a wonderful session. It's very important session. And I just remembered a movie Jhund starring Amitabh Bachchan, where there were some boys who were addicted to alcohol and all sorts of drugs from slum areas called Gali Gundas. And Amitabh Bachchan one day gave him 500 rupees to play football. And he just did it 3 to 4 times. And children, the kids, the adolescents, they started liking football. And now 5th time, Amitabh said, now I don't have money, you arrange yourself. And then the teenagers, they diverted all of their funds, which they used to waste on alcohol and all sorts of drugs, to play football. And in Bollywood style, in the end, they won the match against so-called high-class college students. So yes, risk-taking will be a part of adolescent behavior or adolescent health. What is important to navigate them towards positive and constructive risk-taking behaviors. So thanks, Sulbha, for the session. Now we will move on to the next, last and very important session, for which we have Dr. Suchita Mori sir with us. I request sir to take over the virtual dais and begin with the session, Psychological Development in Teenagers' Life. Over to you, sir.
Thank you very much. Actually, I must thank my dear friend Atul and as well as Maha-IP for Amol giving this opportunity to talk on this virtual dais. And Preeti and Sulbha has given very nice talk. And then I will be talking on psychosocial development in teen years. Actually, this is very important topic, as Atul has told, and psychosocial changes which occur during adolescence. There are 3 important subphases. As all of us know, that there is early adolescence, middle adolescence, and late adolescence. So early adolescence is during the 10 to 14 years, that is in the middle school, and they are progressing through the puberty. The physical changes lead to body image issues, such as there may be breast development, or there may be a height which has increased. So they have body image issues also. Mood swings is there. So they may get easily upset and emotional. There can be extreme cooperation or extreme resistance to adult guidance is seen in this age group. and close friendship with the same sex peer is common with the early adolescence age group. Then in middle adolescence age group, that is from 15 to 17 years, that is they are in the high school or seeking employment. Here the puberty is complete and the adult side is approaching. They have actually developed self-identity and autonomy. But as Sulva has rightly said regarding the risk-taking behavior, there are rash driving, substance use, or sexual activity. Experimentation is very normal, so parents should accept that. Then sexual identity with attraction to the opposite sex is common. Sometimes with the same sex also is seen. Then immense stress regarding the board exams as well as career choices is very important, because in this age it is very important that they go through 2 board exams, as well as there are career problems, and we should help them in making their career choices. Lot of energy. This is very characteristic feature of this middle adolescence, that there is lot of energy and that should be channelized in right direction for the psychosocial and emotional well-being. In late adolescence, what happens that in college age group, that is 17 to 19, they are physically adult, more mature, self-supporting, and they are having vocational training, self-identity is established, well-established sexual identity is there, ability to have intimate relationship, which is again very important point in this age group, that satisfy the emotional and sexual needs of both partners. That is very important. And the healthy family life for themselves or their partners is very important. So what are the 5 I of psychosocial development? First is independence, where we know that in this age group, they are become less dependent on the parents. So the shift is from parents to peers. So many manifest in the form of rebellion against the parents and elders or guardian. They are more independent and they want to become more independent. Young people want to try out new things and experiment, produce rapid changes in self-confidence and behavior. In India, girls are usually given less independence than boys, leading to gender discrimination. Then identity. Here, it is a renewed self-image and identity. They ask the questions, who am I? What can I be? So this process involves doubts and experimentation. And identity crisis in adolescent makes behavior difficult to understand. Media becomes very powerful source of influence in this stage, as we have heard from Preeti also, that provide adolescents with the role model like filmy hero or great athlete whom they try to emulate. Here we must actually tell them that this hero is spending 3 hours in gym also. So that is very important point to remember when they want to emulate them. Such models help adolescents realize their fantasies and dreams. And body image becomes a very important concern for the adolescent. Its gender identity, professional identity, and child and adult identity brings out many crises and psychological reaction. Then intimacy and independence. Here, search for the intimate relationship with the feeling of love and also a desire to be loved is seen. They may make close relationship outside the family or with the peer, and relationship within the family also changes. They may have close relationship with maybe the nephew or maybe mother. So that relationship goes on changing, and it can become a friendship like relationship. So the adolescents often get into conflict with their parents and elders since they want to break away from their control. So they don't want to become actually attached to the parents, as they feel that they are now mature, and adolescents strive to become independent. He detaches himself from his parents, but is yet financially dependent on them. So there is big state of dependency. It confuses and irritates them. So in intimacy and independency, there is attraction towards member of opposite sex, and sex-related emotional experiences like crushes or infatuation also begin to surface during this period. And many girls in India are married adolescents and may become mothers. So they face emotional, physical, or sexual abuse at this tender age. Then integrity. Here, for the sorting out values, peers, media, school, and society. And the adolescent also begins to acquire belief, opinion, attitudes, and stereotype, but society based upon their own understanding. And adolescent also face an information explosion through the internet, TV, magazine, radio, media, and traditional values learned at home confront modern values, leading to confusion over the value system. Then intellect and idealism. Here we must understand that intellectual capacity develops and changes from concrete thinking to abstract thinking. This is very important point. And capable of conceptual thinking and understanding logic and deductive reasoning. So they think in terms of idealistic point of view, trying out new experiences, which can be risky or dangerous. They crave excitement in a way that most adults find difficult to understand. And when they do experiment with drink, drugs, or smoking, they are usually with their friends. So the self-concept and self-esteem of adolescents, actually here, the teens' understanding of self is often full of contradiction. They can be outgoing, but also withdrawn, happy, yet often moody, both smart and completely clueless. So parents, they may seem angrier and sullen, or friends, they are more outgoing and goofier. At the work, they are quiet and cautious. So which one is really me? So they have that question in their mind while when they ask themselves. So older teens actually add values and moral standards to their self-description. And here, the self-esteem often drops when children have transitioned from one school setting to another. These drops are usually temporary, but unless there are additional stressors like parental conflict or other family disruption, then there are problems. Actually, they drop more, become permanent. So the self-esteem rises from mid to late adolescent for most of the teenager. Main areas of identity development can be religious, political identity, vocational, gender, sexual, and ethnic identity. So while monitoring teenager, how we can advise to the parents? That is very important, that too much monitoring will send message of distrust, and too less monitoring will deprive him of protection and guidance in making safe decision about behavior and relationships. So what is important? Trust is the key to finding a balance. And extreme secrecy, however, can be a red flag sign, which should be ruled out. And monitoring teenager without endorsing to his personal space needs sensibility and discretion. So what are the do's and do nots for the monitoring? Knock before you enter his room. Ask permission before looking at his personal belongings. Make ground rules. Do not ask him personal questions such as who he danced in the party yesterday. So be consistent with the ground rules. Teenagers need to know that parents are not pushovers. Stay connected with the trust. Invite his friends at your home. Give space. Communicate with the parents of his friends. Discuss about your concern openly with him whenever required. And avoid listening his conversation on the phone secretly. Avoid going through his diary or phone. Avoid communicating with him on social media. Avoid calling him relentlessly to ascertain his location when he is out of house. And actually, it is very important that open communication and building trust with the teenagers will helpful to balance the monitoring. So then counsel about menstrual hygiene, where you can become a friend of your daughter. It is an opportunity to open the discussion when you are looking into some charts or videos, talk about cleanliness, about premenstrual tension, stress. And if the bleeding is more, then you must consult the doctor. That should be told to them. Then what are the tips which you can tell to the adolescents about the safe sexual behavioral relationship? Here, important point is that present the risk objectively, including emotional pain, STI, that is sexual transmitted infection, and unplanned pregnancy. So avoid lectures and scare technique to discourage sexual activity. Very important is that no one should have sex out of obligation or force. So no should always mean no. Instill in her the skill to say no, which is one of the important life skills. So the important consideration of values, ethics, and responsibilities of family and community should be emphasized. Advised to stay away from the situation that can lead to unsafe sex, and loving and meaningful relationship are healthy and safe. So, madam has already told about the counseling about the risk-taking behavior. So, here important point to remember is that why that risk-taking behavior occurs, because it releases whenever they take risks to test and define themselves, it releases happy hormone, that is adrenaline surge, and so they get a feel good effect, and that's why they continue again and again. So they can try say smoking or drinks. So it makes good evolutionary sense, leading to situation where new skills are learned and new experiences will prepare them for the future challenge. So regarding the high risk behavior, if he has valid driving license, but important is that he should wear helmet, he should follow the traffic rule, he should have calculated risk, which can be told to them. But pathological risk taking is something that may result in injury or death. So drunk and drive not allowed. Forbid use of cell phone while driving. Then values and norms should be talked about them. Monitor them with assertiveness, saying no to the peer. That is very important. Allow him recreational activity, and illustration is very important at illustrating potential consequences of risk taking. So maybe you can introduce someone who has become handicapped after an accident. So that type of things can be done. Then influence of peer group, where it is very important that peer group in their peer group while talking, they should hold their own opinion and not always have to please others. So parents are judgmental while peers are not. That's why teenagers are more friendly with the peers than parents. So listen, love, give latitude and set limits with him and be more friendly with him. So while actually keeping the child in discipline, there are some ideas like avoid responding to backchat with the words, instead walk away or keep busy in some other work. Avoid telling your teenager what he should do. Instead of that, talk to you. You can actually lead by example and make more use of I messages than you messages. Then there are healthy lifestyle in teenager. Healthy habits are very important, and healthy diet. This is the last chance to correct. So they are still growing rapidly and have increased appetite. So it is more difficult to ensure that they are eating right amount of fruit, vegetable, grains, proteins, and dairy products. Avoid junk food and soft drinks as far as possible, because they are not only harmful, but they are addictive. So that's why they should be avoided. And actually, our IIP's new program, Sampurna Swasthya, has really come up with the very good format about avoiding junk food. So healthy habits for teens: make sure that you always have healthy snacks in the house, give homemade tiffin, try to have a nutritious family get together, getting your teen involved in food shopping as well as cooking, and good hygiene like cleanliness of body, teeth, hair, nails, etc. Then actually we should talk more about the healthy lifestyle, where important is that daily exercises, where ground exercises are very important, not only mobile exercises which exercise only your thumb. So they discourage and limit screen, explain benefit of exercises. Sleep hygiene, again Preeti has told regarding the sleep, that these children needs 8 to 10 hours of nighttime sleep. Avoid use of screen at least 1 hour before the sleep, and explain benefit of proper 9 to 10 hours sleep. Then find passion, which is again very important. So find hobbies and interests, and that will definitely handle the stress better and more positive outlook on the life. So that is again important. Then last topic regarding the dealing with the porn in teenagers, because that is I think very commonly parents do come with us that my child is looking after the porn, so what I should do. So it is a distressing situation for parents and teenagers also. It can be just exploring curiosity. So calm down first. Exposure and access are most likely to occur online. It might increase the age. So boys are more likely to be exposed to it, and actually seek it out. So pornography impact on what teens believe about the sex and intimacy, and that affects their behavior, which is very important. And they can have impact in their future married life also. But this is very serious that average age of exposure to pornography in India is around 10 years. And what are the tips for the parents? Stay calm, just listen, reassure, avoid punishment, be supportive and understanding. Tips continue for the parents are plan your talk. So it is actually very important that you should plan your talks. While tempting to give a big lecture, it should be avoided, and plan your conversation about pornography and sex before you start discussion. So
Sorry.
talk about, he left. Yeah, last 2 slides. Actually chance to teach about real intimacy, where they just acting, and respectful relationship is very important. Consent concept should be told to them, and talk about sex, problem solving together. Actually, it is very important that encourage him to think of ways to stay safe, like avoid friends, relatives, and neighbors who are viewing pornography. And encourage your son to talk to you anytime about any question he has or anything else he sees. So that is very important. Thank you very much for this opportunity. Thank you. Thanks a lot.
Thank you so much, sir, for your insights about the topic. So there is one question for you in chat box by Kanika, sir. I'll just read it. Everybody opines that children are maturing earlier than before. So what are your special comments on this, and how does it affect their overall well-being?
Everybody opines that children are maturing earlier than before. Yes. What are your special comments on this, and how does it affect their overall well-being? Yes. This is actually nowadays it is very commonly seen that puberty starts earlier, and that occurs because of the improved nutrition, and that has happened since last few years, that we have seen that the puberty age is going down, and it starts around 9 years of age nowadays average. So this is very commonly seen, but for the parents, you should tell them that this is common, this is normal, but they should know that how these children can be handled. So they should be told about what is the puberty and how the changes are happening in their body, and what are the life skills which can prevent them for the safe puberty. So that is important.
Okay. Preeti, can you hear me? Preeti, are you there?
Yeah, I can hear you. I can hear you. Yes.
Okay. I just wanted you to comment on one thing that you mentioned, that sometimes you need to talk to parents first.
Yes.
So what are those specific situations where you would rather prefer to talk to parents? Because what is happening in our practices, many times it is the parents who approach us. कि मेरा बच्चा ऐसा नहीं करता है, मेरा बच्चा ऐसा करता है, and all that. So then their concerns and everything is so very serious that you prefer to debrief whatever their problems are. And when they bring the teenager seems to be bored looking at you, because the parents, he knows that the parents have already approached you. So how do you tackle such situations, and in which particular situations you prefer to talk to children, parents before the child?
This is a tightrope walk, really, Atul, because if given a personal choice, I would definitely like to talk to the teenager first, because that, because the teenager is my client, not the parent. But we also know that the parent is very closely, the parental behavior, parenting itself is closely related to the issues that the teenager may be having. And many times we've also seen that setting the parenting right has actually, made the whole environment at home less stress-free. So my general thing, which I usually do, is if it is a new patient whom I've never seen before, I would prefer talking to the parent, because I don't know much about the family history. And if the main issue what they are facing is their own conflicts with the teenager. Like he doesn't listen to me.
Your
He's shouting
internet
at me.
is problematic.
Yeah. So I would then, the main issue. Can you hear me? Hello? Can you hear me, Tripti? Okay. So if they have a lot of complaints, when I and when I feel if I see them together, the whole time is going and they're going to make the child's self-esteem really go down. I get that feel on the phone itself. So at that particular time, I would say, okay, come to me and we'll talk about it first and then I will talk. But when I do this, I make sure that the teenager knows that I have talked to the parent first. Now, there are some instances when the teenager insists that he wants to talk to me first and then I respect. So I think it really depends. You have to take a decision on case-to-case basis rather than, you have to be flexible with your approach.
Okay. Am I audible at least, if not visible, because I have a problem with my internet probably. Am I audible?
Yes, you are.
Okay. So I think, Tripti madam, can we wind up the session?
Yes, sir. So I request you to give vote of thanks, please.
Okay. So because in the beginning only I said that it's a homely, informal type of, so there is no vote of thanks because it sounds very formal. And especially in Maharashtra, we don't thank anybody. We are rather very crude type of people that way. But I must thank our state chairperson, Dr. Ramakant Patil sir, Dr. Pawar sir, Amal Pawar sir, who is our state secretary, and Sham Chaudhary sir, who is the treasurer, and our Sucheta Malvatkar madam, who is the chairperson.
I think sir has disconnected.
I think
Tripti?
sir. Yeah. So my heartfelt
There is,
gratitude.
Tripti, just a minute. There is one question by audience. When the teenager is very hard to open up, what to do?
Do you want me to answer that, Sulba?
Yes, ma'am.
Okay. So the thing is, it becomes a challenge sometimes. They don't even come to you, They might just say that they're not interested in talking to you even. So it can range from that to they're sitting in front of you and not opening up, right? It can be there. Now, I'll tell you, after the experience of around these 2,000 odd adolescents, which I've seen in the last few years, I have had only one adolescent who refused to talk to me. And that was a child with autism spectrum disorder. I had a lot of problem in establishing communication with that child. I had not seen the child and they came first to me when the child was 16 years old. But I'll tell you, rest of the children, if your approach, like I gave you a fair idea of your approach and the way you start the conversation with them, right? It really makes a lot of difference. What brings you here? How can I help you? It's a very good opening way of, starting. And if they right away say they don't want to come, they send a message to the parents, they don't want to meet you, please don't force them to come to you. I would say that work with the parents. Nothing stops you from working with the parents. And in many of these cases, if you could work with the parents and just teach them about normal adolescent parenting, many things are actually kind of brought under control. There have been some cases of drug use, adolescents on drugs, and they've just refused to come to my clinic. I've not even seen the adolescents. I've been talking through the parent, and through the parent, I have told them to get them referred to NIMHANS, for example, to psychiatrists. Though they do not come to me, developing that bond with the parent helps them to at least reach to the psychiatrist. So it's not always important that they need to come to you. Sometimes you may just need to refer them, right? But how you refer them, how good, if you can improve the bonding between the parent and the child, I think most of the battles are won. And that is what we need to focus on.
Yes. I just want to add one thing, that there is one selective mutism cases. we do get such cases twice a year or maybe more than that. And these patients actually needs some medicine as well as they because they don't open up in certain areas. Actually, where in school they will not open in but at home they are very frankly. So they do talk at home. So these children are also very difficult to handle, selective mutism cases.
Thank you, sir and ma'am. There is just one last question we will take because of short of time. One question, ma'am, by Dr. Manjusha Sherkar. Sometimes adolescents ask for privacy in the house. How to tackle it? What are your insights about it, madam, sir?
Ma'am, if the adolescent is reluctant to tell about the school or college issues, what to do?
So I would say parenting starts much more earlier than in the adolescent period. So it's how the bond you have developed since there was it was a small child, the child was smaller, and how you have made it a habit of knowing about what has happened during the day. How has the child spent the day? If you can make it as a routine question and you yourself share how your day has been, I think adolescent period should not be difficult at all. However, there are some parents who probably realize the importance of spending time later in the adolescent period. So the only way of, kind of talking and telling the adolescent is to have a good non-verbal communication. Keep your phone aside. You can't be on your phone and asking the adolescent, how was your day? How was your day? And you are scrolling. It doesn't work. Adolescence knows that you don't have an interest. Okay, so probably keeping your phone aside, sitting with the adolescent and saying, I would like to know what happened today. What are the things which made you laugh today? Provided the adolescent doesn't have depression. So a depressed adolescent, you can't say what are the things which make you laugh. That is inappropriate, right? If an adolescent does not have any mental disorder, you could say, what are the things which made you laugh in the college? That is a good opening stance because you know what are the fun things. An adolescent always loves the fun because of a mature reward center. They're looking for the dopamine kick. It could be just taking them out for a walk. It could be joining them in playing badminton. Hey, I'm feeling tired. Can you come with me for vegetable shopping? And after that saying, I loved it when you came with me. So if you can develop the bond with the child, and sometimes saying, I know that you're upset. I'd like to know what is happening. And that also says, I don't want to talk to you about it. Just leave me alone. You say, okay, I'm here for you in the next room. You can come whenever you want. So taking a step back, telling them that you're available for them, usually, helps them to communicate. Of course, you should be on the lookout for, like I said, all the other mental disorders, which may impede communication. And privacy in the house, again, it depends on how the child has been brought up. So if you have been very private, you have been locking your bedroom door all the time, okay, then the adolescent is going to follow the same thing when they want it because you have been locking it. But in case you say, I'm closing it, nobody locks doors. Yeah, when you enter my room, you knock, like what Suchit said. If that is what has been the norm right from childhood, that's okay. That's okay. So what I'm saying is when the adolescent doesn't want you to respect the privacy, yet you want to keep that look of monitoring on because monitoring is so important. And sometimes there is a very narrow, kind of a line between privacy and monitoring. Sometimes you do have to break the privacy to monitor. So, but that is again case specific. Suppose a child is on drugs, then you have to be careful. There's no question of monitoring there, privacy there. You have to be very careful what the child is doing, right? So you have to take a case-based decision. But yes, we do respect privacy on the whole.
Thank you, ma'am. So your insights about the same?
Yeah, actually, most important is that what I have given about do's and do nots was the same thing that regarding the privacy. And you should not encroach into the privacy, but at the same time, you should monitor them what they are really doing.
Yes. Thank you so much, sir and ma'am.
Can we go for a screenshot? If everybody
sure,
can make their camera on,
please,
and then we'll end the session, please.
Right. Please switch on your cameras. Just for 15 seconds, I request everyone to please switch on their cameras and show their beautiful faces. Thank you so much. Thanks everyone. Dr. Sucheta Patil, Madam Sucheta Malvatkar, Madam is here. So I request Madam to say a few words. She is President Nashik AHA. Dr. Sucheta ma'am. Okay. I think we will conclude the session with vote of thanks. As Kanika sir is not there, I would like to continue. So I sincerely thanks all the office bearers, President Maha IIP, Dr. Makan Patil sir, Secretary General Maha IIP, Dr. Amol Pawar sir, Vice President Dr. Shyam Chaudhary sir, Chief Coordinator of the PATH program, Dr. Atul Kanikar sir, Nasik AHA President Dr. Sucheta Malvatkar sir, Sucheta Malvatkar Madam, for arranging such a important and beautiful program for all the general pediatricians all over India. My sincere gratitude to all the speakers, Dr. Preeti Galgali Madam, Dr. Suchita Ambori sir, Dr. Sulbha Pawar Madam, for the great academic brunch today. I would like to thank to all the delegates for making the program house full, and it just denotes the success of the program. And my sincere thanks to Pallavi Dharmadhikari, who is a technical person, for successfully giving technical support for the program. And here I would like to conclude the session. Thank you so much, everyone, for joining today.
And Trupti, we are also thankful to all the central AHA members who are joined here from all over India, including Dr. Aryan Sharma sir. Thank you so much.
Thank you very much.